8 out of 10 people over 60 taking vitamin D3 right now are wasting their money. Not because the supplement is bad, but because of 3 critical timing mistakes that nobody talks about.
Robert, that's a bold claim. Are you saying the supplement itself works, but people are sabotaging their own results?
Exactly. I'm talking about patients who buy expensive pharmaceutical-grade D3, take it religiously every single day, and their blood tests still show severe deficiency. The problem isn't the pill.
I've seen this in my practice too. But in Japan, we approach supplementation very differently. We prioritize food sources and natural sunlight first. What you're describing sounds like a uniquely Western problem.
Well, here's the thing. Margaret, 73 years old, came to my clinic completely exhausted. She'd been taking 5,000 IU daily for 2 full years. When I tested her blood, her vitamin D level was 19 nanograms per milliliter.
Wait, 19? That's clinically deficient. How is that even possible if she was compliant with the dosage?
That's exactly what I asked. Then I reviewed her routine. She took the pill every morning with black coffee and a slice of dry toast. 0 fat in that meal. D3 is fat-soluble, Akira. Without dietary fat, it goes straight through.
In Japan, we don't usually prescribe isolated D3 supplements like this. We recommend fatty fish, eggs, mushrooms. The fat is already there naturally. But I understand why you prescribe it in the US. Your elderly population has much lower sun exposure.
Exactly. And the problem is that most patients think they're doing everything right. They're taking the pill, they're consistent, they check the box. But they don't understand basic absorption science.
So what did you tell Margaret to fix this?
I told her to take her D3 with her biggest meal of the day, which for her was lunch. She started eating it with salmon, avocado, or even just a spoonful of olive oil. Within 3 months, her levels jumped to 42 nanograms per milliliter.
That's a massive improvement. But Robert, I have to challenge you here. Why are you prescribing 5,000 IU to a 73-year-old woman? In Japan, we'd consider that dosage excessive and potentially risky for long-term use.
Because American seniors are chronically deficient. We're talking about people who spend 90% of their time indoors, live in northern latitudes, and have darker skin or reduced kidney function. 5,000 is conservative for that population.
I see your reasoning, but I worry about toxicity. Vitamin D accumulates in fat tissue. Over years, high doses can lead to hypercalcemia, kidney stones, vascular calcification. We've seen cases in Japan where Western tourists overdose on supplements.
That's fair. But those cases usually involve people taking 50,000 IU or more without medical supervision. I test my patients every 6 months. If their levels exceed 60 nanograms, I drop the dose. It's managed.
Okay, so you're monitoring closely. But let me ask you this. Did Margaret experience any symptoms before you corrected her intake method? Fatigue alone isn't specific. How did you know it was vitamin D deficiency?
She also had bone pain in her hips and lower back, mild depression, and frequent upper respiratory infections. Classic deficiency symptoms. When I ran a full metabolic panel, her parathyroid hormone was elevated, which indicated her body was stealing calcium from bones.
That's serious. In Japanese preventive medicine, we would have caught this earlier through annual checkups. We don't wait for symptoms to appear. We test vitamin D levels as part of routine elderly care, especially in winter months.
I wish we did that in the US. Most insurance companies won't cover vitamin D testing unless there's a medical reason. So patients only find out they're deficient after they're already symptomatic. It's reactive medicine, not preventive.
That's the fundamental difference between our systems. In Japan, prevention is cheaper than treatment. We invest in early detection. But I'm curious, Robert. You mentioned 3 timing mistakes. We've covered the fat issue. What's the second mistake?
The second mistake is magnesium depletion, and this is where things get dangerous. When you take high-dose vitamin D without adequate magnesium, the D3 activates enzymes that consume magnesium rapidly. Your magnesium levels drop, and you start experiencing symptoms.
Wait, so vitamin D supplementation actually depletes magnesium? I didn't realize the mechanism was that direct. What symptoms are we talking about?
Muscle cramps, especially at night, heart palpitations, chronic fatigue that doesn't improve even when D3 levels normalize. Patients come back and say, "My vitamin D is perfect now, but I still feel terrible." That's magnesium deficiency talking.
In Japan, we rarely see this because our traditional diet is naturally high in magnesium. Seaweed, tofu, green leafy vegetables, whole grains. We don't need to supplement magnesium separately. But I can see why this is a problem in the West.
Exactly. The standard American diet is magnesium poor. Processed foods, white bread, too much meat, not enough greens. So when you add high-dose D3 on top of that, you're creating a deficiency crisis.
So what do you recommend? Do you prescribe magnesium supplements alongside vitamin D?
Absolutely. I tell every patient starting D3 to take 300 to 400 milligrams of magnesium glycinate daily. Glycinate is the most absorbable form. Oxide causes diarrhea, so I avoid that. Patients need to understand this is a package deal.
That makes sense. But Robert, you're treating this with more supplements. In Japan, we'd recommend dietary changes first. Pumpkin seeds, almonds, spinach. Why not start there?
Because compliance is the issue. I can tell a 70-year-old to eat 2 cups of spinach daily, but will they actually do it? Probably not. A single magnesium pill is easier, more reliable, and delivers a consistent dose.
I understand your logic, but I think you're underestimating patient education. If you explain why spinach matters, many people will change their habits. In Japan, we spend more time teaching patients about food as medicine. It works.
Fair point. But let me ask you this. How do you verify compliance with dietary changes? Do you test magnesium levels, or do you just trust that patients are eating enough greens?
We test when necessary, but we also track symptoms. If a patient reports muscle cramps or fatigue, we adjust their diet before resorting to supplements. It's a slower process, but it builds long-term healthy habits.
Okay, I can respect that approach. But here's the reality. In my practice, I see patients who are already sick. They don't have time for slow dietary changes. They need immediate intervention. Supplements are faster.
That's the difference between reactive and preventive medicine again. You're putting out fires. I'm trying to prevent them from starting. Both approaches have value, but I still think prevention is more sustainable.
Agreed. And honestly, if I had the time and resources to educate every patient on diet, I would. But the American healthcare system doesn't allow for that. I get 15 minutes per appointment. Prescribing magnesium takes 30 seconds.
That's a system problem, not a patient problem. In Japan, we allocate 30 to 45 minutes for elderly care appointments. It's a different philosophy. But I understand your constraints.
Appreciate that. Now let's talk about the third mistake, which is timing. This one is subtle but devastating. Most people take vitamin D3 in the morning because that's when they remember. But D3 affects melatonin production.
Wait, are you saying vitamin D interferes with sleep? I haven't heard this before. What's the mechanism?
Vitamin D activates the same receptors in the brain that regulate circadian rhythm. When you take it in the morning, it signals your body that it's daytime, which is fine. But if you take it at night, it suppresses melatonin and disrupts sleep architecture.
So Margaret was taking her vitamin D in the morning, which was correct. But what about people who take it at night? Are they causing their own insomnia?
Yes. I've had patients complain of insomnia, restless sleep, waking up at 3 a.m. unable to fall back asleep. When I ask about their supplement routine, they're taking D3 right before bed because that's when they take all their pills.
This is fascinating because in Japanese traditional medicine, we've always emphasized timing for supplements and herbs. We take energizing herbs in the morning and calming herbs at night. It seems like modern science is validating ancient wisdom.
Absolutely. And the irony is that vitamin D is essential for good sleep, but only if you time it correctly. It helps regulate serotonin, which converts to melatonin at night. But if you take it too late, it blocks that conversion.
So the optimal timing is morning or early afternoon, correct? And it should be taken with a fatty meal to ensure absorption. That's a very specific protocol.
Exactly. And here's what I tell patients. Take your vitamin D3 with breakfast or lunch. Make sure there's at least 10 to 15 grams of fat in that meal. Eggs, avocado, nuts, olive oil. And take magnesium separately, either with dinner or before bed.
Why take magnesium before bed? Doesn't that affect absorption?
No, magnesium actually promotes relaxation. It calms the nervous system, reduces muscle tension, and improves sleep quality. So, taking it at night serves a dual purpose. It replenishes what vitamin D depletes, and it helps you sleep better.
That's clever. So you're using the timing of each supplement to maximize both absorption and therapeutic benefit. I have to admit, that's a well thought out protocol.
Thank you. But here's the thing, Akira. None of this is complicated. The science is simple. The problem is that nobody explains it to patients. They buy D3 off the shelf, read the label that says take one daily, and assume that's enough information.
And that's where patient education fails. In Japan, pharmacists spend time explaining how to take supplements properly. In the US, you just grab it off the shelf and hope for the best.
Exactly. And the result is that millions of people are taking D3 incorrectly, wondering why they don't feel better, and eventually giving up on it entirely. They think supplements don't work, when really they just didn't know how to use them.
So let me summarize what we've covered so far. Mistake 1. Taking vitamin D without fat, which prevents absorption. Mistake 2. Not supplementing magnesium, which leads to depletion and side effects. Mistake 3. Taking it at night, which disrupts sleep. Is that correct?
Perfect summary. And these mistakes are so common that I'd estimate 80% of my patients were making at least one of them before I corrected their routine. It's almost universal.
But here's my concern, Robert. You're treating vitamin D deficiency with high doses and strict protocols. In Japan, we would question why the deficiency exists in the first place. Are your patients getting any sunlight at all?
Most of them, no. They work indoors, drive cars with tinted windows, wear sunscreen religiously because they're terrified of skin cancer. The result is that they produce almost zero vitamin D naturally. Supplementation isn't optional for them.
I understand. But in Japan, we encourage safe sun exposure. 10 to 15 minutes of midday sun on arms and legs 3 times per week. No sunscreen during that time. It's enough to produce adequate vitamin D without supplementation.
That works in Japan because you're closer to the equator, and your UV index is higher year-round. In northern U.S. states, from November to March, the sun angle is too low to produce any vitamin D, even if you're outside naked at noon.
That's a good point. Geography matters. But even in winter, couldn't people use UV lamps or light therapy to stimulate vitamin D production?
Theoretically, yes. But UV lamps that produce vitamin D are expensive, hard to find, and most people won't use them consistently. A daily pill is cheaper, easier, and more reliable. That's why I recommend supplementation.
Fair enough. But let me push back one more time. If you're prescribing 5,000 IU daily to patients for years, are you worried about accumulation? Vitamin D is stored in fat tissue. Over time, couldn't that lead to toxicity?
That's why I test every 6 months. If levels exceed 60 nanograms per milliliter, I reduce the dose. If they go above 80, I stop supplementation entirely and retest in 3 months. Toxicity is rare if you monitor properly.
Okay, so monitoring is key. But in Japan, we don't have the same testing infrastructure. Most family doctors can't order vitamin D tests routinely, so we have to be more conservative with dosing to avoid risk.
That makes sense. And honestly, if I couldn't test, I'd probably recommend lower doses too. Maybe 2,000 IU instead of 5,000. But with testing, I can be more aggressive because I know exactly where each patient stands.
That's the benefit of having robust lab access. In Japan, we rely more on clinical judgment and symptom tracking. It's less precise, but it works for our population.
And that's the beauty of medicine, right? There's no one-size-fits-all solution. You adapt to your population, your resources, and your healthcare system. What works in the US won't work in Japan, and vice versa.
Exactly. And I think that's the key takeaway for viewers. If you're taking vitamin D3, make sure you understand how to take it properly. With fat, with magnesium, at the right time of day. Don't just swallow a pill and hope for the best.
Absolutely. And if you're experiencing symptoms like fatigue, bone pain, or insomnia despite taking D3, get your levels tested. Don't assume the supplement is working just because you're taking it. Verify.
And if you can, prioritize food sources and sunlight first. Supplements should be a backup, not the primary strategy. Your body absorbs vitamin D more efficiently from natural sources.
Agreed. But for people who can't get enough from sun or food, supplementation is essential. Just do it correctly. Follow the 3 rules we've discussed, and you'll see real results.
And if you're not sure whether you need supplementation, talk to your doctor. Don't self-diagnose based on vague symptoms. Get tested, get advice, and make an informed decision.
Now let's talk about what happened to Margaret after she fixed her routine. Remember, she was at 19 nanograms per milliliter, clinically deficient, exhausted, bone pain, the whole package. 3 months after adjusting her protocol, she came back for a retest.
And her levels jumped to 42, correct? That's a huge improvement. But did her symptoms actually resolve? Or was it just a number on paper?
Her symptoms resolved completely. The bone pain disappeared within 6 weeks. Her energy returned. She stopped getting frequent colds. And the most interesting part, her mood improved dramatically. She told me she felt like herself again for the first time in years.
That's the power of correcting a deficiency. But Robert, I want to ask you something. Did you change anything else in her routine, or was it purely the vitamin D protocol adjustment?
Great question. I also had her add magnesium, which we discussed earlier. And I recommended she start walking outside for 20 minutes daily to get some natural sunlight. So it wasn't just the supplement, it was a combined approach.
See, this is where I think we agree more than we disagree. You didn't just prescribe a pill and send her home. You addressed lifestyle factors too. That's preventive medicine in action.
Absolutely, and I think that's the lesson here. Supplements are tools, not solutions. They work best when combined with healthy habits. But the reality is that most patients need the supplement as a foundation because their lifestyle alone won't get them there.
Fair enough. But I still believe that if we invested more in patient education up front, we could reduce the need for high-dose supplementation. It's a philosophical difference, but both approaches can coexist.
Agreed. And honestly, I'd love to have the time to educate every patient the way you do in Japan. But the system I work in doesn't allow for that, so I do the best I can with the constraints I have.
And that's all any doctor can do. Work within the system while trying to change it for the better. So let's shift gears. We've talked about the 3 mistakes. What about people who are already taking vitamin D correctly? Are there any additional considerations?
Yes. One big consideration is vitamin K2. This is something most people don't know about. When you take high-dose vitamin D, it increases calcium absorption. But without K2, that calcium can deposit in arteries instead of bones. That's a problem.
Wait, so vitamin D supplementation can actually cause arterial calcification if you're not taking K2? That's alarming. Why isn't this common knowledge?
Because most doctors don't know about it either. The research on K2 is relatively recent, and it hasn't filtered into mainstream medical education yet. But the mechanism is clear. K2 activates proteins that shuttle calcium into bones and teeth, not soft tissues.
In Japan, we get K2 naturally from fermented foods like natto. It's a traditional breakfast staple. Most Japanese people consume K2 daily without even thinking about it. But I can see why this would be an issue in the West.
Exactly. Americans don't eat natto. They don't even know what it is. So if they're taking high-dose D3 without K2, they could be increasing their cardiovascular risk over time. That's why I recommend K2 supplementation alongside D3.
What dosage of K2 do you recommend?
100 to 200 micrograms daily of the MK7 form, which is the most bioavailable. Some D3 supplements now include K2 in the formula, which makes compliance easier. Patients only have to take one pill instead of two.
That's a smart approach. But again, I'd argue that eating fermented foods is a better long-term solution. Natto, sauerkraut, kimchi. These foods provide K2 along with probiotics and other nutrients. Supplements can't replicate that.
I don't disagree, but realistically, how many Americans are going to start eating natto? It's an acquired taste. I've tried it. It's slimy, it smells strong, and most Westerners can't get past the texture.
True, but that's a cultural barrier, not a medical one. If people understood the benefits, they might be willing to try. We need better education around fermented foods.
Agreed, but until that happens, K2 supplements are the practical solution. They're cheap, effective, and easy to take. I'd rather have patients take K2 pills than risk arterial calcification.
Fair point. So we've covered vitamin D with fat, magnesium, K2, and proper timing. Is there anything else people need to know?
Yes, one more thing. Vitamin D works synergistically with vitamin A. If your vitamin A levels are low, D3 won't function properly. They regulate each other. Too much D without enough A can cause problems.
This is getting complicated. So now we're talking about D3, K2, magnesium, vitamin A, fat, and timing. How is the average person supposed to manage all of this?
It sounds complicated, but it's actually simple once you set up the routine. Take D3 and K2 together with breakfast. Take magnesium with dinner. Eat liver or eggs once a week for vitamin A. Done. It's not that hard.
Or you could just eat a traditional Japanese diet. Fish, seaweed, fermented soy, eggs, vegetables. You'd get all of these nutrients naturally without needing to think about supplement combinations.
You're absolutely right. But again, cultural context matters. The average American isn't going to eat seaweed and natto for breakfast. They're going to eat cereal or a bagel. So we have to meet people where they are.
I understand. But I still think we should encourage dietary changes before resorting to supplements. It's a more sustainable, holistic approach.
No argument there. But in my experience, most people won't change their diet until they experience a health crisis. Supplements are the bridge that keeps them healthy while they figure out the lifestyle changes.
That's a pragmatic perspective, and I can respect that. So let's bring this back to the viewer. If someone is watching this right now and they're taking vitamin D3, what should they do immediately?
First, check your bottle. Is it just D3 or does it include K2? If it's just D3, consider switching to a combo formula. Second, make sure you're taking it with a fatty meal. Third, take it in the morning or early afternoon, not at night.
And fourth, add magnesium if you're not already taking it, either through supplements or food. Pumpkin seeds, almonds, dark chocolate, spinach.
Exactly. And fifth, get your levels tested. Don't assume you're in the optimal range just because you're taking a supplement. Blood work is the only way to know for sure.
And if you can, prioritize sunlight and food sources first. Supplements are helpful, but they shouldn't be the only strategy. Nature provides vitamin D in the most bioavailable form.
Agreed. But for people living in northern climates or those with darker skin, supplementation is essential, especially in winter. Don't skip it just because you think you're getting enough sun. You're probably not.
Good point. And for viewers in Japan or similar climates, focus on maintaining healthy vitamin D levels year-round through diet and moderate sun exposure. Don't wait until you're deficient to take action.
Absolutely. Prevention is always better than treatment, and vitamin D deficiency is one of the easiest things to prevent if you know what you're doing.
So let's summarize the key takeaways. Mistake 1. Taking vitamin D without fat. Mistake 2. Not supplementing magnesium. Mistake 3. Taking it at night and disrupting sleep. And the bonus lesson? Consider K2 and vitamin A for optimal results.
Perfect summary. And remember Margaret's story. She did everything right except for the fat issue, and it cost her 2 years of suffering. Don't make the same mistake. Take 5 minutes to optimize your routine.
And if you're experiencing symptoms like fatigue, bone pain, or frequent infections, get tested. Don't ignore the signs. Vitamin D deficiency is incredibly common, especially in people over 60.
And one more thing. If your doctor dismisses your concerns about vitamin D, find a new doctor. This is basic preventive medicine. Any physician worth their license should be willing to test and address deficiency.
Strongly agreed. Your health is your responsibility, but your doctor should be a partner in that process, not an obstacle.
Exactly. And that brings us to the end of today's discussion. We've covered a lot of ground. The 3 mistakes, the fixes, the additional nutrients to consider. If you take one thing away from this, let it be this. Vitamin D3 works, but only if you use it correctly.
And if you can, build a lifestyle that minimizes your need for high-dose supplementation. Sunlight, whole foods, movement. These are the foundations of health. Supplements are just the scaffold.
Well said. And on that note, I think we can agree that both approaches have value. Aggressive supplementation when needed, preventive lifestyle when possible. The best medicine is the one that works for the individual patient.
Absolutely. And thank you for this conversation, Robert. I think we've given viewers a lot to think about.
Likewise, Akira. Always good to debate these topics with someone who challenges my thinking. That's how we both get better.
Agreed. And to the viewers, thank you for watching. If you found this helpful, share it with someone over 60 who's taking vitamin D. They might be making one of these mistakes without even knowing it.
And leave a comment below. Tell us, are you taking vitamin D correctly? Did you know about the fat rule? The magnesium connection? We want to hear from you.
And remember, this information is for educational purposes only. It's not medical advice. Always consult your doctor before starting or changing any supplement routine.
Absolutely. Your individual health needs are unique. What works for Margaret might not work for you. Get personalized advice from a qualified healthcare provider.
And with that, we'll wrap up. Until next time, stay healthy, stay curious, and keep learning.
See you in the next episode. Take care.
One last thing before we go. If you're interested in learning more about preventive medicine and longevity, check out our other episodes. We cover everything from heart health to hormone optimization.
And if you have topics you want us to discuss, drop them in the comments. We're always looking for new ideas based on what you want to know.
Exactly. This channel is for you, so let us know how we can serve you better.
All right, that's it for today. Thanks again for watching. We'll see you soon.
Take care, everyone.
And remember, small changes lead to big results. Fix your vitamin D routine today, and you'll feel the difference within weeks.
Absolutely. Don't wait. Start now.
All right, signing off. Stay healthy.
Goodbye.
Actually, one more quick point. If you're taking other medications, especially blood thinners or thyroid meds, talk to your doctor before adding vitamin D or K2. There can be interaction.
Good reminder. Safety first. Don't assume all supplements are harmless. Some can interact with prescription drugs.
Exactly. And if you're pregnant or breastfeeding, definitely consult your OB/GYN before starting any new supplement regimen. Your needs are different.
And for anyone with kidney disease, be extra cautious with vitamin D. High doses can worsen kidney function. Always work with a nephrologist.
Great point. Kidney patients need special protocols. Never self-prescribe high-dose D3 if you have compromised kidney function.
All right. I think we've covered everything now. Any final thoughts, Robert?
Just this. Knowledge is power, but only if you act on it. Don't just watch this video and forget about it. Take action today. Check your vitamin D routine, make the necessary changes, and commit to your health.
Perfectly said. And on that note, we'll truly sign off now. Thank you for your time, and we'll see you in the next episode. Stay well, everyone.